from Lanka. I'm Ganewata from Health Informatics Society of Sri Lanka. We welcome you to the fourth Sri Lankan eHealth Hour, organized by the Health Informatics Society of Sri Lanka, collaborating with the Asia eHealth Information Network. We are on today the Executive Council members of history. You become members of eHIN around the world. Several experts of health informatics, including medical officers of informatics, staff of universities, as well as postgraduate students in health informatics joining our webinar today from all over Sri Lanka. Thank you all. Sri Lankan online knowledge sharing session, where in health informatics will be sharing their knowledge and experience on topics of in real time using web platform. Being a presentation by a panel of experts, followed by a question and answer session where you can actively involve. Sri Lanka will be held fortnightly on 2nd and 4th Thursdays of month between 12 noon to 1 p.m. Before today's session, I'll be mentioning a few things into the WebEx. The panel is where you shall see the content presented by the panelists, including presentations, videos, etc. The right useful tools. If you click the participants icon, it will display all panelists currently logged into the event. It can be used to questions from the panelists. And during the presentation by clicking no, too fast, too low, buttons. Please note your microphone will be automatically muted once you join in as an attendee. Unmuted upon request should you wish to join for a session with audio. If using receiving audio during the webinar, please log out from the WebEx platform and try to log in. The topic for strategic planning for Readiness, explained the Department of Health Services, Northwestern Province by Dr. Arjuna Vijayakon. The Health Informatician, Department of Health Services, Northwestern Province, Sri Lanka. Dr. Arjuna, prior degree in Bachelor of Medicine and Bachelor of Surgery from University of Kelaniya in 2002. Theoretic and for 8 years, he obtained his master's from University of Colombo in Biomedical Informatics. We allow him as the resource person for our Sri Lankan eHealth Hour. Over to you.
To you. Today I will be sharing the experience of Northwestern Province of Sri Lanka on and implementing a strategic plan for e-readiness in healthcare sector. In my presentation, I will be covering with a brief introduction and its healthcare sector for international participants of this webinar. Then, an overview of Northwestern Province and the Provincial Department of Healthcare. We'll have a quick look on what is e-readiness. Finally, on the strategic plan for management of information and electronic communication of the Northwestern Province. Brief overview of healthcare sector of Lanka. Lanka is a country country that transformed from a low-income country to a middle-income country within the last 5 years and having a population of about 20 million. Sri Lanka is having a socialist healthcare system which is free for the end user, that is the care recipient, but we also have a fairly good private sector healthcare system. According to the available statistics, government sector care and 9% of the inpatient care. Almost all the late 1980s, government healthcare sector operates under two basically. Firstly, the Ministry of Health, which usually use the word term the ministry, and provincial departments of health that under the 9 provinces of the country. The tertiary care is provided by the 50 hospitals administered by the Ministry of Health. 9 provincial departments provide secondary care through about 100 hospitals and primary medical units, and also provides preventive care while 340 odd community care divisions, which are officially called MOH or Medical Research of Health Divisions. The bird's eye view on healthcare sector Sri Lanka. Let's focus on the northwestern province. The northwestern province covers 12% of the landmass of the country, and that is 12% of the population. The province is having 2 healthcare districts, named Kurunegala and Puttalam, and it has only hospitals that is administered by the other care. All other institutions are under the provincial department of health. Department of Health Services is the largest department of Provincial Council of the Northwestern Province. We are having 200 institutions and across the province, 90 hospitals and primary medical care units, and 45 MOH divisions, that is community healthcare divisions, having about 1,200 capacity under 100 categories or 100 designations. Throughout the decade, there are attempts to introduce computer-based information systems to the provincial department. This included several systems, clinical and non-clinical systems, such as information systems, disease notification system, mobile devices, ICU bed allocation systems, maternal and information system, information management systems, among the technical systems that were introduced in the department. And several non-clinical systems also introduced, for example, human resource management system, physical resource information management system, now could sustain or scaled up. These were abandoned or remain as a small islands of automation without scaling. targeting department identified several reasons of the implementation of the systems that we pilot. Poor literacy among the staff was identified as the main of the failures, and several other also identified as reasons for failure. Communication infrastructure was one of the main reasons failures, and lack of and interoperability the requirements as other reasons. One that I have not mentioned is not having a coordinate or a focal point activities on information and ICT. All in one, this could get under the umbrella term the lack of readiness. What is or the electronic readiness? The readiness is the degree to which an entity is prepared to obtain benefits adopting information and communication technology. This is several components. The availability of hardware structure to access the network or internet or a private network, whatever. The improvements as policy guidance on privacy standards on security, and the service provided on ICT and on health information, and the sustainable or availability of required financing. That is trust fund of World Bank to our ICT and achievers in its report in 2005. The time identifying the gaps, starting papers, and doing conferences on gaps. Working on ICT, all these things. Be focused and oriented. We decided to have an action-oriented medium-term strategic plan. For management of information and electronic communication 2012-2016. The Professional Department of Services, Northwestern Province of Lanka. The strategic plan vision of delivery of high quality health care, informed decision making. The mission is to facilitate informed decision making by managing the information and computerized solutions and optimally care recipients. And optimally at this point that or decision to computerize all the procedures information flows of the department. So we will select the appropriate and we will do it optimally. It should have safety and privacy of the care patients. Three views. to the management capacity to through the main activities planned 11 we progress up to now. We have to go. The management capacity department, ICT and Health Information Systems, we established a Health Information Management Unit as the provincial focal point with adequate physical and resources. Then come a training about computers for hands-on training. This training is being conducted. Around 100 healthcare staff were already trained on ICT and basic. These are carried under 3 custom. This is on IT for office staff, basics of ICT and health information, and a program for upper and level healthcare managers. Internet access lines were paired in a proper use of bandwidth. This has prevented most of data and bandwidth. We designated staff CT and information activities. Northwestern province is having its own ICT service, which is the Northwestern Provincial ICT Service. The department is now having fairly adequate number of ICT officers and ICT assistants. We external level data repository. Actually, I have not ticked here because we just started getting it a days back. So we will be having our own provincial data repository and will be shared with all required national level institutes. With the new system, one of the administrative districts, one of the 2 administrative districts of the province. Activities under an objective, that is to improve the communication and information dissemination via electronic means. In 2011, universal, we never had the voice connectivity 60% of our we as a priority before the data connectivity. Within 2 years, we could achieve the universal voice connectivity under a corporate package, which is very cost effective. And we have started providing cost effective and reliable data connectivity. Having effective reliable data connectivity almost all the institutions except the medical we have our own email domain, and the staff is encouraged to use the electronic means for communication rather than the postal means. Postal units of fusions are being strengthened to help electronic communication. We have improved our presence and services. DVS website was giving the info on the stuff, but now the site recipients and the staff. The last activity, which is the local area network, is the one activity we are having lack of progress. The inadequate funding for the strategic plan. Probably we might not achieve activity completed within the plan period, so we may have to continue it for the next year. Move to the third objectives. The third objectives are to facilitate and streamlining and standardization. The three curricula for the we are the staff for free and open source software and provided with the to use in the institutions. What standard is being used for standard the best using local languages, electronic communication, and then we have CD and standards are being implemented. Department of Health in the Northwestern for last few years is a ground for research and development and pilot testing the systems in healthcare sector. They have very successful on the healthcare. Have started service analysis and process engineering. We hope we improve our efficiency and effectiveness to high very soon. We have reached the end of the presentation, and I have to say is the journey, not a destination. So we are on the track. I hope we are achieving the next level in a future webinars. Thank you.
Thanks. It's an informative, elaborated presentation and usually inspired the audience with your presentation. I'm sure you must be having a lot of questions to clarify from Dr. Arjuna. The Q&A button on your right panel, type in your question. We will try our best to accommodate all the questions. We provide the facility to ask questions using voice provided if you have internet connectivity and a minimum background disturbance. Leave in Q&A box if you are available for connecting via voice. we'll showing you the presentation done by Dr. Arjuna of the eHealth hour. We have received several questions. The first question: what are the challenges that were faced during training people?
A good question, because we face a lot of challenges in this service training program. Firstly, there were no developed criteria that is for our requirement. We have, because of the capacity of our element depending on the category and the frequency source. We had in the first year, we of the staff, some of trainers. We could develop a fairly curricular, could have a resource that from continue the training. The challenge we faced initially were poor participation. In the initial year, we selected and needed trainees of staff of department. We realized that the participation was poor and the output was also poor. And we call applicants openly and select from the slide for the training. Now we need much better participation and much better outcome. This challenge facing is funding. Still having a sustainable funding to continue the training, but would manage every year to find funds from one or other and continue training about 3 years. I think are the challenges we face in the trainings.
Thank you. Next question is: do you think that an EHR, electronic health record, is feasible in Northwestern Province in the near future? Then your experience.
Okay, it's a question. If you mean by the word EHR, if you mean a record and all the involved information in name-based record, not identified as a priority requirement at this point of time. We go for non-clinical systems required for the healthcare sector and clinical systems that in aggregated data at the point of time, rather than going for electronic health records. Achieving those, I think in the future we can think of implementing electronic health record.
Thank you very much, Dr. Arjuna. We have another question. What are the indicators you think of using in measuring e-readiness in your province?
We selected several to cover the readiness. Not having the entire list, but the indicators that comes into my mind. A number of institutions with voice and activity, one of the fundamental requirements. We have achieved 100% voice connectivity. We have achieved about 80% data connectivity users other than primary medical care units. And the number of healthcare staff trained on basics of ICT and basics of health information systems. We have several means of training staff. The in-service training we have started within our department at our health information center. And then we have an ICT training institute for the provincial council of trainings on that. Trainings such as the staff for Readiness training on geoinformation systems. Number of staff trained on ICT and health information is one identified indicator. And then number of active official email accounts. There is active official email accounts because we have email accounts, active. Number of active official email accounts is one mean whether the staff is actually e-ready. We also can use the visitors to the department website to see if our students and our staff is actually ready to accept the.
Thank you. The next question is, does the lack of national eHealth policy affect in organizing infrastructure and policies in Northwestern Province?
Do you mean not having any health policy for the country or for the province?
For the entire country.
Okay. As I know that there is a draft the information policy and draft on the guidance on eHealth and the on eHealth. I put that standards and guidelines on eHealth is already run the policy at this point of time. First, Northwestern Province was the place for testing the proposed guidelines and the proposed standards. It's a process, I think, but the guidelines and standards are drafted and then piloted or implemented in a area in the Western Province, and that is revised and improved depend on the experience and outcome of the province. So at this point of time, I track that find the guidelines standards, and they will ultimately help a eHealth policy in the country.
Thank you. We have another question, but I think you already answered part of the question during the first question. You answered the first question. Anyway, how do you find funding that you're doing?
For funds.
How do you find funding for the extensive work that structure development and training?
no route for us to have the funding for this. But we have several options to name. We have that is province specific, then health sector development project, and special funds and development. Every year we could manage to not from single source but several sources, and so we are happy that we have adequate funding. Agree that systems we should have a sustainable and a permanent method of funding to continue these activities.
Thank you. Next question is, if an institution wants to implement the plan you have presented, how do they reach you?
We are happy to share our experience and our strategy plan. I think already shared our strategic plan with about provinces, and we have already shared our voice and data solution with several provinces, and we have shared our strategic plan, and it was accordingly and being used in several health institutions. So anyone here wants details and to share our strategy, you can always contact us. For Sri Lanka, it's 37 56 contacting us. Lanka, it's 003 04 37 56 80 804 720
Thank you. Several more questions. The next question is, for providing data connectivity, what is the recommended type of connectivity experience? Is it cable or fiber optics or mobile?
No hard and fast answer for that. It Northern province is more, the places are remote, where the connectivity is very poor. So we prefer because that and most of the places we have supplied the wide connectivity. But areas that is not available. We have moved to the mobile 3G range. If available, the 4th generation wire coverage. In few institutes, that we would not go either. So we are thinking of an alternative method of the information from those, but the is very few. So it depends on the place and the availability.
Arjuna, the contact number Dr. Arjuna gave is available in the Q&A panel, if you can note it down. The next question is, do you have IT human resources in-house? Do you outsource them as required?
Okay. The answer is we both. For last 3 years, recruited staff from the non-province service. The graduate doctors with masters in biomedical informatics, we have the capacity up to level do in-house development. But for we go for outsourcing. Even the outsourcing is in 2 levels. The provincial council of the Northwestern province is having its own arm for software development. So, going without outsourcing for the externalizations, we have the option of outsourcing for the soft development arm of the provincial council, which is under a different ministry of the same provincial council. So we have governance, that is in-house development by our staff of the Provincial Department of Healthcare, and then to the soft development arm of the Provincial Council, and instances outsourcing for the totally external organizations. Yeah.
The next question is regarding use of licensed operating systems. The practice you have implemented, is it purchasing proprietary operating systems or free and open source operating systems?
It's a good question and a tricky question. So we the both, that is moving from actually in 2011, according to the surveys we have done, all the operating systems and other software were not, you say, not really. It is most of the time it was software. So I think it's in a developing country like this, it was the norm. But we plan to make our department free of pirate software. Options: free and open source, or buying the licensed software. All the we have decided at operating system which is Microsoft Windows based. On that, we need to use all the software as much as possible, free and open source alternatives. So the use of commercial package with LibFish and training the other like diagrams and for so on. So it's a mixed situation. For system, we are buying the commercial license, and for software, we are going for free and open source alternatives. And I don't have to talk about clinical or the custom-made solution for health innovation, which is made basically custom-made for us. For all the softwares, we are having the mixture. The one rationale behind this is at this point of time, if I to move to free open source operating system, we overloaded with the work. So we are from the scratch for us, or the in the future we will reach a point we from system open source operating system. So we are familiar with the open source packages. So in the system. So we are solution system.
Thank you for your answer. We have another question. I hope you must be providing a valuable service through the knowledge you gain following the MSc course in biomedical informatics. How many other medical officers of health informatics available for the activities within your province?
Three with biomedical informatics for the province, but one may be serving for the live ministry. That is the one of the two directly under the live ministry, and we have one minister of health innovation or the minister of health implementation for the province, and one health innovation for one of the districts. We need more, at least the other province, but still I think we can, as at the senior level, we could have we are having fairly enough number of officers in health implementation, but the problem is being trained medical officers in the system.
We have another question. I appreciate you providing web access across all healthcare facilities in your province. Will you take any measures to filter or restrict internet access for purchase by the end users? For example, social media.
And the data connectivity for all the institutions, there is a lot of abuse of provided for the staff. We staff experience on internet, so experimenting, they become clear, and they are not clear on what be done and what is not to be done. So we found out that no technical solution will come up with line and educate our staff on this. So a fair, comprehensive internet guideline to ensure that is used only is used for purposes. Our in our data capacity. Also, we are seeing the effectiveness and efficiency of our staff. Sometimes using internet for and for communication, which reduce the efficiency of the service provision. After clear guidelines, staff is and what is not appropriate. We had for the rest we'll go for the technical solutions that is the technical control of social media. In my experience, I think most of the ban used for non-legal purposes is for the use for social media and for YouTube, Facebook and YouTube. Yes.
Thank you. The next question is, how is the response support from higher authorities about the program, and do you think there should be more involvement from them?
Good question, because before starting working as the institution for the province, in not get support in my staff, but I found they really enthusiastic and really keen on IT and health information solutions. Understandable, because it's a new thing. They want to make sure they're doing the correct thing. This is the reason that we started the program level managers. So, before anything, we always advocate them on the needs and cons of this, and we discuss with them and get their needs and give them the time to clarify any questions on this. So by doing this, we have overcome any probable, and I think help from the higher level authority is good.
The next question is also a part of the previous one. What are the good outcomes which you obtained so far?
The outcome in this strategic plan, we focused on readiness rather than individual solutions. The strategic plan developed in mind that having the good human capacity, good activity, we could not implement and upscale any electronic solution. So keeping in mind, I think we have a good readiness, and from now onwards, so we have started that province is now having the capacity to restart all the most of the systems that is abandoned due to lack of infrastructure or lack of trained staff. And we are successful on implementing the systems developed by the life industry, especially on disease surveillance and EMMR systems that is being developed. We are implementing successfully. Other than that, we have started our own solutions for manage the physical resources and to manage the human resources that is coming directly under the provincial council. And we had to continue because there were systems developed by the ministry for the country. The good example for this is the system for about 4 years to the logistics of medicine. We implemented a very good system for retail drugstores, but now is a much better system, interoperable system that's being implemented throughout the country. So we discontinued it. Still, we can be very happy because the new system, they have studied the system developed previous Western province. So it was a good input to this national system. I think in next December, we have achieved almost all the targets we set for readiness, and from there onwards, it's about developing the solutions, individual solutions, according to the identified priorities.
Thank you. We have what is the response to intermittency? Any particular challenges you have faced so far?
Rather tricky question because we have so far not touched the innovation care. So I have a much resistance when and in Sri Lanka started implementing a system in a setting. It's obvious factors. There's the space factor, you name it. It's something very difficult at point. So we have not touched that level. We only touched so far the OPD level and the care level. At those two levels, the understanding from the clinical staff is excellent, I can say. We missed any obstacle from the staff level for piloting or implementing any system, clinic PD level or in setting.
Thank you very much. The next question is, based on experience, what is the capacity of medical officers in health informatics implementing eHealth solutions throughout the country? Do you receive any support? Do you receive any support from IT solutions providers from government and private?
Can you repeat the question?
Yeah, the capacity of medical officers in health informatics in implementing eHealth solutions throughout country. They receive any support from IT solution providers from government and private sector?
I think we have to identify that medical officers in health information or the health information then is to bridge the gap between the clinicians and CT staff. To more specific, there are 3 people that should be get together and be coordinated via medical trained on health information. That is ICT staff, the clinicians, and the administrators. Because implementation, not implementation, any research, any development, filing and implementation should be a teamwork. It is coordinated. The implementation. Example, a system on community care. We computer option is to be given a specific field of health information of the to automate, what section not to automate, and up to should be automated, and what is not be. Most of these things should be come cluster. Could be the level, the particular responsible for that. The absolute level of public midwives, public and medical officer of health who are managing the grassroots level staff should take leadership. Action should give all the support and gap between the administration, IT, and clinicians. If this is clear and if medical health information in mind, I don't think there will be any obstacle of implementing. I think medical information should contain in one other aspect, that is in prioritization. Could help the administrators to price. There won't be any obstacle that could not be overcome.
We have one final question. Says, I appreciate the service you are providing at provincial level. Do you have anything to mention that could inspire a medical officer who is interested in taking up a career in health informatics in future?
Field of health informatics is not established field. So, in field in a country, including in Sri Lanka. So there will be no very clear path. The life is not easy. I think it's something that is unique or special for health informatics. It is common for any with an emerging. So if you are to get this and you are innovative, field to enjoy work.
Since we have run out of time, we'll be concluding the 4th Sri Lankan eHealth Hour for today. I have any further questions to ask from Dr. Arjun? account, we feel free to them to us. We need to distribute the resource material and answers to the questions through email. If you could this webinar. Join us for the next Sri Lanka Tower webinar on 10th September 2015 at 12 noon. If you are medics and willing to share your experience with health community of Sri Lanka, we can contact us. Once again, we are grateful for presenter today for sharing with us the valuable information, and so Dr. Roshan Hewapatrana, the CEO, who is with me here at his. And finally, I must thank all our attendees from all around the globe. On 10th, from Colombo.